Hello, hello. My name is Jones, and today we are going to look at the surgical condition known as bends. We're looking at this surgical condition, okay, that necessarily talks about bend wounds. The general objective of this lesson is that at the end of this lesson, you should be able to know the you should be able to know all the nursing education and nursing important points that you need to be equipped with when nursing a patient with bends. In short, the general objective is for you to develop nursing knowledge about nursing a patient with bends. The specific objective of this lesson is for you to know the definition of bends, for you to know the skin anatomy related in relation to bends and classification of bends, for you to understand the different classification of bends, for you to know the pathophysiology of bends, for you to understand the different causes of bends, for you to know the complications that may come because of bends. So, those are the specific objectives of this lesson to do with bends. Okay, so let's move on to understand the definition of bends. I have three definitions of bends, and the last one will try to conceptualize on the scientific definition of bends. Bends mostly are looked at as thermal injury to the tissues, which is caused by dry heat or upon contact with strong alkaline or acids. This is the general view that we have about bends before necessarily we came to this lesson as a thermal injury. But bends do not necessarily come because of thermal contact. They may come because of contact with strong alkalines or strong acids. That is why these elements have been added to definition of bends. So the second definition of bends that we can appreciate is that these are injury to the tissue that are caused by heat, chemicals, electrical current, or radiation. This definition was put forward by Lewis and his records and his colleagues. Okay, as an injury to body tissue that is caused by heat, chemicals, electrical currents, or radiation. So these four components may result in bends once one is exposed. Okay, so they may cause injury to a body tissue. So this definition enlightens us that burns is not only exposure to thermal energy that is higher than our normal body temperature that may damage the tissue, but things like heat, chemicals, electrical current, and radiation may also result in burn injury. The last definition that we can look at for burns is that these are skin injuries that will result from heat, electrical currents, chemicals, or even friction or excessive exposure to sunlight. So, based on the standard depth of injury classification, burns can be looked at as first, second, or third degree. Burns may result from heat, electrical current, chemicals, and now in the last definition, here we are saying we are adding two elements that may also result in burn injury. That is friction and also exposure to excessive sunlight. Okay, so we have discussed these elements that helps us to understand burns and helps us to define a burn injury. Now, let us appreciate the anatomy of the skin so that we can understand the standard depth of injury that burns can be classified in. So, the skin has got the epidermis part, which is the topmost part. The skin has the dermis part, which is the middle layer of the skin. Then it has at the bottom the it has the hypodermis part. So the hypodermis is the fatty layer under the skin. Under the fatty layer, we find aligning muscles. So when you're talking about burns, they may affect the epidermis only. They may affect the epidermis and the dermis. They may affect the epidermis, dermis, and hypodermis, and at times they may affect the whole thickness. The whole thickness, I mean epidermis, dermis, hypodermis, and the muscle area. Muscle area, muscles hold together bones. So you find that when muscles are affected, even bones will also be affected. We should take keen interest also in some of the parts that are found within this structure. You can see in the epidermis there we have the hair shaft, we have the sweat pole, okay, and we have the nerve endings. Okay, so in the dermis, we have the roots of the hair follicle, we have the sweat glands, okay, and we also have the sebaceous gland, okay, just around the hair follicle. Then in the hypodermis, that's where we find the adipose tissue. In the hypodermis, we find the adipose tissue. Then we have the underlying muscle. So it is important as we understand the classification of burns so that we know the part of the skin that has been affected and what it may result. Please remember the hypodermis, it has no nerve endings. The nerves are starting from the dermis. From the dermis there, then the dermis. From the dermis, then to the epidermis. Any injury to the nerves will cause some kind of pain. And then if all the nerves are destroyed, there will be no pain. Okay, so this is just to help us appreciate the skin anatomy as we endeavor to understand the classification of burns. Anyway, for those that are okay, the pictures I'm about to show of how the skin can be affected may be a little bit sensitive, but burns may affect the topmost, the deeper layer, and may also affect the muscle tissue. So these are just some examples of burn injuries. Okay, and all credit goes to the people that make these photos available for us to learn from them. So you can see those nasty burns there affecting the face, burns affecting some deeper tissue, and burns also affecting the underlying layers. Okay, so from this, let us now talk about causes of burns. Burns can be caused, from our definition, we said heat, chemicals, and the likes. So we are appreciating these causes separately. So can be caused by flames from a fire. It can be caused by hot metals. It can be caused by electric and gas fires. It can be caused by lightning, can be caused by friction, can be caused by acids and alkaline. So these causes can be categorized as chemical, electrical, radiation, and the likes. So under chemical, we're saying most chemicals that may cause burns are strong acids or bases. Then when we say electrical, electrical burns are caused by either an electric shock or uncontrolled short circuit. Then radiation. Radiation burns are caused by protracted exposure to ultraviolet light. This may constitute overexposure to the sun. There are others that may go for tanning boots in order to help with their skin. Okay, so tanning boots may use ultraviolet light. So this, if there is overexposure, it may result in burn injury. For the sake of radiotherapy in cancer treatment, also exposure to ultraviolet light may cause burns. Other parts that we need to understand are radioactive fallouts and X-rays that under radiation they may cause pain. Okay, so there is something also here, a type of wound that belongs to burn injury, but this one we call these scalds. So scalds are thermal injury that are caused by moist heat. Okay, scalds. Okay, here just saying moist heat here. So the causes are boiling water, steam from boiling water, porridge, or cooking oil. Okay, so this is an example of a scald. Okay, so it may result from boiling water, porridge, and the likes. Okay, so this one is a burn injury, but the burn injury known as the scald. Types of burns according to cause. Types of burns according to cause, as we have discussed, we have thermal burns, meaning burns that are caused by exposure or contact with flames, hot liquids, semi-liquids, okay, semi-solids, or hot objects. Then the other type of burn according to cause is chemical burns. This we have said is strong acid, alkalis, or organic compounds. Then the other type of burn according to cause is electrical burns, and this is through electrical energy when it is introduced or passed through our body may cause electrical burns. Radiation burns, they are coming as a result of exposure to radioactive source such as nuclear radiation, accidents, and therapeutic irradiation and sunburn. There are also types of burn known as inhalation injuries. These will come because of exposure to smoke or flame injuries. Okay, so let us now look at another part of our lesson, and this has to do with classification of burns. There are various ways of classifying burns. Burns can be classified according to degrees. Burns can also be classified according to depth of the burns. And burns can also be classified according to extent of the burn area. Okay, so we have the nomenclature part within this table, the traditional nomenclature, the depth, and the clinical findings. So when you're looking at superficial thickness, these are first degree burns. And first degree burns, from our revision of anatomy and physiology, it affects the epidermis. And if it is affecting the epidermis, the clinical findings will be erythema, there will be some pain, and there will be no blister or there's lack of blisters. But when you talk of partial thickness or superficial bends, okay, according to the traditional nomenclature, these are second degree bends. Okay, so when we talk of superficial, okay, partial thickness, the depth here they affect the top part of the dermis or the superficial part of the dermis. So if the superficial part of the dermis is affected, then there will be blister formation. There will be a clear fluid that will accumulate within the blister, and there will be involvement of um, a, a bigger part of the nerves causing a lot of pain. Then there's or partial thickness or deep bends. So these are third degree. So partial thickness will affect the deep lenticular parts of the dermis. So we see a white appearance or a fixed red staining, and we see reduced sensation because the deeper part of the dermis is affected. So you see that some nerves part of the nerves will be damaged. Then we have the full thickness. Full thickness, according to traditional nomenclature here, we're saying these are fourth degree bends. The depth is that it will affect the epidermis, the dermis, and there will be complete destruction of the subcutaneous fat. There will be some kind of scar formation, and pain is minimal because most of the nerves have been damaged. These types of bends may require skin grafts in order to reduce on the scar that is formed after healing or to reduce on contractures. The clinical findings is that there will be a charred or rather thrombosed blood vessels that are going to be seen on clinical findings. But we can still expand these details. Okay, so bends by degree, we have first degree bends, second degree bends, and we have third degree bends. We have examples here, uh, bends according to degree, bends coming from sand bends, okay, bend coming from sand bends, and okay, then we have bend affecting the superficial part here, and we have bends here again showing that are also affecting the superficial part, and then the other part here where deeper part of third degree bends would necessarily look like. Okay, so classification according to depth or that is of bends and degrees. We said there is superficial bends or first degree, and the only part that is involved or destroyed is the epidermis. So when there's this destruction, on the signs and symptoms, we see redness of the skin, and then pain is going to be seen or is going to be observed due to involvement of nerve endings. So this is an example of first degree burns. First degree burns, okay, that's affecting the skin there with no blister, and the other type of first degree burns where we see some blister formation. Then there's partial thickness burns or second degree burns. The epidermis and part of the dermis is destroyed in second degree burns. It will extend into the superficial or the papillary part of the dermis. We see the redness, and we see the redness of the skin, blister formation. We see that there's local infection because of compromised skin barrier. And let me be quick to mention that second degree burns are the most painful because of nerve damage that affects the top part of the nerves that are found within the dermis. So, the most painful type of burns are second degree burns because of increased involvement of the nerve damage that we see in second degree burns. Okay, so these are examples of second degree burns. Skin acts as barrier to infection. So there's risk of infection when the skin barrier has been disturbed, as we have seen. Okay, so deep partial thickness or third degree burns. In third degree burns, the epidermis and the dermis is destroyed. And we are saying it extends through entire dermis and it is painless because of loss of nerve fibers. There will be loss of nerve fibers because the dermis has been destroyed. For this type, it may require excision and then the scarring and contractures and also amputation may be required because there will be disturbance in blood flow or vascularization because blood vessels within the dermis have been destroyed that are supposed to supply them that are supposed to supply the other parts of the body with the blood, oxygen, and nutrients. So we find that all this is destroyed. So amputation may be one of those things that may be advised. May be advised, or that might be a solution. Scarring also affects blood circulation. We see contractures in this type of burns. So here is an example of third degree burns. This type of burn was due to high voltage. Okay, so third degree burns here, there is scar formation, there's a escalatomy of the burn forearm and the hand can be advised, removal of the scar. So when the skin integrity is compromised, we see risk of infection. Here we see because of damage to the skin here and the dermis, we see compromised distal vascularity and circulation. Okay, then full thickness burns of fourth degree. So all three layers of the skin here are destroyed. All the three layers: epidermis, dermis, okay, and the hypodermis. So this extends through the skin, subcutaneous tissue, and into the underlying muscle and bone. It is painless but painful at the periphery. That is on the sides, on the sides or the end part there. Find that not at the middle where it has reached the bone and the legs. So bone does not have nerve endings. So it requires excision and may also require amputation for significant functional repairment. For significant functional impairment, so may require amputation. Classification according to Warris rule. There is the rule of seven. Okay, in the rule of seven, the body is divided into parts of sevens. It is used in children. This rule is not necessarily popular for the rule of seven, but we are saying it is used in the children, the rule of seven. For adults, we use the rule of nine. In the rule of nine, the body is divided into parts of nines. So, this is the rule which is popular and mostly used in our practice. The body then will be divided as follows. So the head is 8%, the neck is 1%. So head and neck is 9%, the rule of 9. Then the upper limbs, each is 9%. Then the trunk, okay, that is front part 18, the back part 18. Then the lower limbs, each is 18%. Then the perineum part is 1%. Let me display this data in this way because when you add all these percentages that have been apportioned for each part, you should have 100%. So head and neck, we have 9%. Then left arm 9%, right arm 9%. Anterior trunk, you can remember you can have the upper part and the lower part. So it's C 9 9 making 18. Posterior trunk, you can have upper part and down part making 9 9. So the same applies for the legs. 18 18. We can have the upper part and the lower part of the leg. So 18 18. Then the perineum 1%. When you add all this, it gives you uh, 100%. That is for the rule of 9, calculating percentage of body fluid lost using the Wallace rule of 9. Okay, in diagrammatic form representation, here for the adults, we have the head where we're saying the head 9%. This is the head. So the head here, that is with the neck included. We have head with the neck included, we have 9%. So you can apportion neck 1%, front part of the face 4 point, that is um, front part of the face and also the back part of the face. Okay, then we have the trunk, the that is 18 in front, 18 behind. Together, when you add this, gives you 36%. Upper limbs 9% each. So these are the hands 9%, 9%. Okay, so you have 9% the one hand, 9% the other. Then for the legs, each is 18%. The top parts 9%, the bottom part or the lower part of the limb 9%. So collectively makes 9. So applies to the other leg. Then at this part, the perineal area, okay, we call it the 1% area. 1%. Okay, that is according to the Wallace rule of 9. Okay, so the percentage, yes, these were approximated using the palm. Okay, so the palm in approximation, palms, the number of times that it will go there. So on the Wallace there, well, that is on the perineum, just find one hand is going there to cover that. So one hand there, 1% there. Okay, so now we come to the 7% apportioning. That is for children using the rule of sevens. So using the rule of sevens, here what we can say, the lower part of the leg is 7%, and the upper of the leg part of the leg is 7%. So the whole leg is 14%. So applies to the other leg. So both legs put together makes up for the trunk and the face. Both legs put together make up the total for the trunk and the face. Whilst the hand is half is half the percentage as compared to the leg. Whilst the hand is half the percentage as compared to the leg. So that is how you can remember. So it is in the multiple of 7. It's in the multiple of 7. Okay, so this has to do with the rule of 9 and the rule of 7 a demonstration. And this is how you can remember them. Okay, that is When you remember for the feet, one feet is 14%, the other feet is 14%. And collectively together, it sums up for the trunk and the face. Whilst the hand is half one leg, percentage approximation. Okay, so from there we can move on and continue on classification of bends. So in children, the head and the trunk provide more proportion than the legs. The implication is that the more the area is bent, the less chances of survival or for survival. Okay, so if 60% of the area has been bent, the person is likely to die. Remember, we our body is composed of 60 to 70%, which is water. 60 to 70% is water. So if 60% means there's only about 10% of water remaining in the circulation, and this can bring about shock. But if 30% of the patient, let's say there's 30% of burns, then this may require critical care or patient may be critically ill. Then if it is 10%, there are more chances of survival for the patient who suffers 10% burns. Let us now look at another part of our objective of understanding the pathophysiology. Okay, so in understanding pathophysiology, it will help us to understand the, the problems that may come because of burns. So, the skin's ability to stop the water loss from the burned area will be reduced considerably by the thermal injury because of the destruction of the integrity of the skin. There will be a fluid shift for the first 48 hours. Fluids containing water, sodium, chloride, and colloids are going to escape from the intravascular compartment into the interstitial spaces. Potassium then moves in from the damaged cells into the bloodstream. And with increased potassium in the bloodstream, it may lead to cardiac arrest. The destruction of the tissues and the cells is also contributes to the loss of electrolytes. There will be like sluggishness of blood flow. This will lead to hemoconcentration. It will lead to reduced cardiac output. It will lead to decreased tissue perfusion, may cause hypoxia, may also bring metabolic acidosis, which eventually will lead to shock. So, sluggishness in blood flow. If blood is not moving fast according to the way it's supposed to flow, meaning there will be concentration of blood, increased concentration of blood, which affects the output because the heart is not necessarily filled up nicely because of the sluggishness of concentrated blood. The concentration of this blood also brings about destruction of red blood cells, leading to anemia. Anemia here, if red blood cells are destroyed, it means we are reducing the oxygen carrying capacity. Okay, so that's what we can say about the pathophysiology of burns. Now we look at signs and symptoms. This is another part of our specific objectives, understanding the signs and symptoms in burns. So patients may be in shock. This may come because of either too much pain or it may come because of hypovolemia. Patient may be in severe pain depending on the classification of burn or the parts that is involved. So severe pain in partial thickness bends or pain will be absent in full thickness bends. It will be absent, but on the periphery, there's some pain that is felt because of minimal damage that happens within the periphery of the wound. There is reduced urinary output due to fluid loss and increased or decreased perfusion. So urinary output is going to reduce. We necessarily see all signs of dehydration because of electrolyte loss that we see in burns. Okay, so now let us look at the other part of the objective, and that is management of burns. So, first aid management of burns is that you have to remove patient from danger or remove danger from the patient or from the casualty. Do not remove adherent clothes as you may pull off the skin that that has been charred or that has been burnt as the patient was getting burnt. Okay, so some clothes may stick to the skin, and as you remove, you may also remove some of the skin, increasing fluid loss. You can cover any exposed area with a clean, dry dressing or a sterile dressing. Remember, in the first 24 hours, it's advisable not to give anything by mouth due to due to paralytic areas that may result. Patient is at risk of carrying ulcer, okay, which will come because of increased gastric secretion. The smoke may irritate the GIT and cause this. If patient is in shock, treat with unnecessary fluids to reduce the shock. You can dispatch the patient to the hospital as quickly as possible. Okay, so the main objective of managing a patient with burns is to maintain a patent airway, maintain fluids and electrolyte balance, and also prevention of infections and other complications. Maintaining patent airway is that even when there is no obvious injury, inhalation of smoke may cause inflammation of the respiratory tree. Maintaining fluid and electrolyte balance is because the patient is going to lose a lot of fluids after sustaining burns. So you need to maintain a strict fluid and intake balance to rule out um, kidney failure, okay, and also prevent shock. Prevention of infection because of compromised skin integrity, patient is at risk of wound infections, and burns themselves bring about complications in different systems of our body. So, first, in managing of burns, we are saying you're going to follow the emergence in the first 24 hours, the emergency management. In the emergency management of burns, you ensure the airway is patent. If there are any blockages within the airway, you remove. Ensure breathing is within normal range and is not compromised. Take care of circulation because there will be loss of fluid or there is loss of fluid. So you can look for signs of compromised airway and inhalation injury, which can be fatal. Someone confined or trapped in an enclosed space during fire or involved in an explosion is at risk of developing pulmonary complication from inhaling toxic fumes and smoke. The resuscitation and stabilization phase begins with the reassessment of the injured person's airway. So here we are still emphasizing the ABC of emergency management: airway, breathing, and circulation. Appropriate intervention should be initiated necessarily to help patient stabilize. Okay, so it may also involve aggressive fluid resuscitation. And if inhalation injury is suspected, you may need to do intubation to help easy breathing because it will be difficult to promote oxygen exchange if the upper part of the respiratory tract is blocked from the inflammation that may come because of inhalation. So you may need to do intubation. So in dens, here we are saying where there is inhalation, intubation may be one of those things that you may do in order to promote a patent airway. Once the injured person has been stabilized, then the attention can be turned to the care of the burn wound itself. Until then, it's advisable to cover the burn wound with a clean and dry dressing. Okay, so there is this part which is also very, very important that I feel should be emphasized: intravenous fluid resuscitation of patients with burns. So children with, let's say, about 10% total body surface area burns and adults with above 15% total body surface area burns are going to need formal fluid resuscitation and monitoring of blood pressure, pulse rate, temperature, and the urine output. So once the burning process has been stopped, the injured person should be resuscitated according to Parkland's formula. So let us understand Parkland's formula. So this formula calculates the amount of lingus lactate. This is a type of fluid. So it calculates the amount of lingus lactate required to be administered over the first 24 hours post burn. So the formula is as 4 mils times percentage of the total body surface area, TBSA. In short, total body surface area that has been burnt. This total body surface area you will calculate using the Parkland's the Wallace rule of 9 there, so you can use that to calculate. Then you have to multiply with the body weight of the patient. Let's have an example. For a 70 kg patient with 50%, that is total body surface area bent, it will mean within the formula, Parkland's formula, okay, we are supposed to replace. So 4 mils is it's a fixed figure. So 4 mils times total body surface times person's body weight. So we are saying 4 mils times, in our example, 70 kg is for the total, that is the weight of the patient. And then the total body surface is 50%. So this will give us 14,000 mils. 14,000 mils, that is 14 liters in 24 hours. That is what we're supposed to give. Okay, 14,000 mils, that is what we're supposed to give. This is according to our example here. For a man with 70 kg, with a total body surface of 50% area that has been bent, it will mean we are supposed to give 14,000 mils, that is within the first 24 hours. Okay, so how then do we give? We divide the 24 hours in 3 8 hours of the day. So the first 8 hours, you give half of the total amount that you found according to total body surface area that has been bent and the kg. So from our example, we have 14,000 mils. So half of 14,000 will be 7,000 mils or 7 liters. Then the last 2 8 hours, 8 hours, you give quarter of the total. So quarter of the total, that is quarter of the 14,000 mils. The quarter is 3,500 mils. So given in the second 8 hours and also given in the third 8 hours. You need to note that as you are giving these fluids, you should have at least urine output of 30 to 50 mils for you to rule out renal failure. For good concentration, there should be about 30 to 50 mils. Then you are likely to yield good results. It will not result into renal failure. Remember, reduced cardiac output. So you need good cardiac output in order to have good perfusion. So perfusion, this can be appreciated on how well the kidney is functioning. So 30 to 50 mils, we have to monitor urine output. Okay, so now on this formula here and our example, please appreciate that to find the total that they're supposed to get in 24 hours, you need to replace within the formula the weight and the total body surface area in percentage that has been bent. When you have found the total in 24 hours, then that's when you can now divide into the half and quarter for the 3 8 hours of the day, making up 24 hours. Okay, so that is on the fluids. Okay, other things that you need to do in managing the patient bends is that they are in a lot of pain. Paracetamol may not wait. So you might need to administer pethidine whenever necessary. On wound care, debridement, that is cleaning, then dressing the wound is important. Okay, the wound should be regularly re-evaluated until it is healed. The wound is cleaned daily with prescribed antiseptic. And remember to calculate nicely, because if you don't calculate nicely the required antiseptic, you find that these same antiseptic may open the wound or make the wound become big, because they may also cause some kind of insult to tissue. So you need to calculate nicely so they do not cause injury to the tissue. Burns can be dressed with also Vaseline gauze, or it may be closed with other dressings. Observe wound for redness, gangrene, and other infection. Gangrene, it calls for splenectomy or debridement. Signs of infection, you see pus. The pus formation, sign of infection. Redness, it's a good sign that the wound is healing. So there's redness there. There are no infections. Okay, third and fourth degree burns may require skin grafting. Should there be need, the donor area has to be prepared. So there is preparation of the area where the skin will be taken from, but it will be put in the other area. So how do you prepare the donor area? You have to clean and shave that area. Use antiseptic, okay, on the donor area to ensure that skin is healthy, that will be taken and is free from infection. Recipient side is only ready when the granulation tissue is ready and sepsis is eliminated. Granulation tissue on the area that is going to receive the 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 donated or the graft part of the skin. Okay. Other parts of management of this patient is that veins from this cell, okay, so contains tetanus. So tetanus toxoid should be given to protect the patient against tetanus. Antimicrobial agents such as silver sulfadoxine or silver nitrate, 5%, should be administered on the wounds for infection prevention sake. Antibiotics like ciprofloxacin cannot be given. Okay, so the other part of treatment, apart from use of drugs, okay, is surgery. So surgery, wounds require surgical closure with skin grafts or flaps should be dealt with as early as possible. Circumferential bends of digits, limbs, or chests may need urgent surgical release of the burnt skin. May need what we call a sclerotomy, removal of sclerotomy, to prevent problems with distal circulation or ventilation. When the leaves chest has been bent, it affects breathing, and any contractures within this will also worsen breathing. So, a sclerotomy will help ease the breathing. Alternative treatments, we have hyperbaric oxygenation. Okay, it has been used since ancient of times as it helps to aid wound healing. may be beneficial in the first and second degree burns, but it has risk of causing infection. Let us now look at complications of burns. So complications can be appreciated by system. When you talk of the cardiovascular system, complications that may result within the system is hypovolemic shock, anemia. So these are the two most important complications that may come. Respiratory system, due to maybe edema, inhalation, okay, it can be obstruction of airway. Respiratory system, obstruction of the airway due to the edema because of inhalation. The urinary system, the complication that we can see is renal failure due to hypovolemia or reduced perfusion. In GIT or gastrointestinal tract, the complication that we can see is Kehling's ulcer. These are due to decreased production of mucus and increased gastric secretion. Musculoskeletal system, we see contractures, and the immune system, we see risk of infection due to compromised face defense system. I've already mentioned anemia coming because of destruction of red blood cells. And then for the GIT, apart from Kelly ulcers, we can also have GIT bleeding. Okay, so let us now look at the nursing care of patients with this. This is after you've done all the emergency nursing care. But what are some of the other things that you do in the nursing care? So dressing a wound, vitals. This is to ensure that all vital organs are performing very well or they are just working very well. Carefully assess wounds for signs and symptoms of infection, including erythema, edema, increased heat, and also discomfort. Nutrition, remember 24 hours, not giving nothing, not giving anything by mouth, but nutrition here, they still require proteins for repair of bone or tissue and restoration of this same tissue that might have been bent. Things is to provide high quality. This is to supplement for the additional minerals and also vitamins that the patient may also need. So high quality can be given for each patient's weight. Also, this is just for monitoring nutrition status. Fluid elimination with patients observing urine outputs in relation to fluids given. Instead, 30 to 50 mils at least. It's something that you need to reach in order to rule out volemic shock, okay, in order to rule out renal failure or getting in of renal failure. So monitor input and output. Infection prevention, you have to conduct dressings aseptically and also practice reverse barrier nursing. Ensure the room is well ventilated to avoid infection within the room. Again, debris bath, removal of debris from the skin as debris may become source of infection. The nails of the patient should be kept short because they may harbor microorganisms. Other aspects of grooming also should be taken care of. Physiotherapy exercises are quite important to prevent contractures and promote blood circulation to the rest part of the body for patients with burns. What information and education can you give? Or information, education, and communication can you give? So reinforce patients' knowledge on wound care, proper nutrition, follow-up care, management of the scar, and management of the pain. And then teach patient signs and symptoms of wound infection and remind the patient to keep outpatients appointments. Also, you can talk about patient avoiding the things that might lead to burns. So it's important to avoid this. This is in order to prevent the patient coming to the ward or to the hospital again with the same problem. So that's how you manage the patients with burns. You understand the calculation of fluid replacement. If you do an independent exercise based on different case studies, then you can understand the replacement of fluids that's supposed to be used for each and every patient that we have discussed within this. Okay, so there you have it. We've been discussing burns. Okay, critical condition. We discussed the definition of burns, causes of burns, signs and symptoms of burns, pathophysiology of burns, complications of burns. So those are some of the things that we looked at within this lesson. So for me, I'm saying thank you and keep studying.